A busy ward at Barts in the London on a Tuesday afternoon. 3 of the staff on duty, a nurse, a surgical registrar and a microbiologist, remain haunted by the events of that afternoon. George Brown is developing a chest infection after his surgery. He was given an antibiotic containing penicillin to treat that infection.
Mr. Brown, talk to me. Help! Call the doctor. Mr. Brown! Mr. Brown! Talk to us! Brown, can you hear us? Mr. Brown! Mr. Brown! Mr. Brown, talk to us!
Cardiac arrest, AW6. Okay.
Mr. Brown! Mr. Brown, stay with us!
Yeah, Angela's staying with us.
Mr. Brown! I was just injecting you.
However, this particular patient was allergic to penicillin and suffered a severe anaphylactic reaction and a subsequent cardiac arrest, which proved fatal. The patient was known to be allergic to the drug. It was clearly documented on his drug chart, and he was wearing a red wristband. Despite this, it was still prescribed and administered. How could this mistake happen? Significant breaches in hospital policy plus human error contributed to the death of this man. The microbiologist should at this stage have checked with the prescriber if the patient had any allergies. The surgical registrar should have checked the allergy status of the patient prior to taking advice from the microbiologist and/or prior to then prescribing the antibiotic. The nurse should have checked the allergy status of the patient before giving the drug, checking on the drug chart on the wristband and asking the patient themselves.
I made this mistake. I think that's down to human error. I'd had a long, busy day. I was under a lot of stress. I was also fatigued. I allowed Dr. Jangohar to pressurise me into making a quick decision. I didn't take time to check my notes. All of the above.
We all should have checked. The system is there that I should have checked the procedure, I should have checked for allergies, the microbiologist should have checked, and the nurse who administers the drug should have checked, both in patient's chart and on the patient's ID tag. In this particular incident, we all failed to follow the procedures, which resulted in the tragic death of a patient.
I administered the wrong drug, and Mr. Brown died as a result of that.
I feel very angry about this whole experience. Because as a microbiologist, I don't prescribe for patients. I only offer advice. And we have standard operating procedures there to cover us in case somebody along the line makes a mistake. And that wasn't followed by anybody.
I changed hospitals because I didn't want to work in the same hospital anymore. I couldn't have faced that. I think I am quite lucky because I still work as a nurse while I'm waiting to hear whether I'm going to lose my registration or not.
The final decision is with GMC to decide whether I was negligent or not. So that is still pending.
After 20 years of being a doctor, I'm considering not practicing anymore.
In this situation, primary responsibility is with the prescriber, yet everyone has their role to play, each one acting as a check against error. The doctor makes all of his checks prior to prescribing, and then the nurse repeats those same checks prior to administering. Cross-checking is about respecting each other professionally and acknowledging that many aspects of healthcare, such as giving medication, are actually high-risk events. Assumptions are another human factor that played a major role in this incident. Every professional assumed, whether consciously or not, that someone else had checked or would check the patient allergy status. Assumptions are dangerous.